So looking at this injury, how did this doctor think, okay, this is how I'm going to do this. How can we make this work? Because obviously it's something that's common.
Yeah, well, I always joke with patients that orthopedic surgery is basically you're repeating things over and over and over again. So the principles are very much the same as doing an ACL or other kind of ligament reconstruction, where you take another part of the body, in this case you take a tendon,
okay,
and then you weave it back into the bone, and then in time your body actually takes that tendon and turns it doesn't necessarily turn it into ligament, but it turns it into like tough scar, so it functions as a ligament.
So it hardens?
Yes.
Okay. So can someone go back to pitching? Can a player go back to pitching, or a patient go back to doing everyday activities after a surgery like this?
Yes, definitely. It takes a long time. So this is a surgery that I like to say when I do it, it takes a long time to cook. So I mean, this is something that takes a year to a year and a half to actually get back to play. Yeah.
So a player is out for that amount of time?
Correct.
Okay.
Correct.
Wow, okay.
You can get back sooner, but really the better thing to do, the better part of valor, is to give it time to actually heal.
But is it only a baseball player injury? Or do you often see patients with an injury like this, or maybe another sport? I mean, female athletes who play softball or basketball players, can they suffer from Tommy John?
Certainly. So you can tear that ligament doing something traumatic. But the funny thing about it is it doesn't matter so much if you don't play baseball. One of the examples I use with everyday people, like let's say you dislocate, let's say I trip over a curb walking out of here and I dislocate my elbow. I wouldn't need this surgery because I'm not out repetitively throwing a baseball. Richard Sherman is a cornerback for the Seattle Seahawks, or was. He, in the Super Bowl, actually tore his Tommy John ligament and looked into getting it fixed. And some of his teammates actually told him, you know what, you actually don't need to. So over the offseason, he healed and was able to play football again without any problem.
Wow, and so how do you know when a Tommy John surgery is in fact needed in the case of Sherman and not needed?
Well, honestly, if you're not a throwing athlete, my initial treatment for you is going to be non-operative. I'm going to talk to you about rehab. I'm going to talk to you about different kinds of pain medicine you can take. And in the case of a professional athlete, and then people who really are interested, you may talk about stem cells or PRP. But technically, you don't even have to do that.